Hello, I'm CPTJ Hirakawa. I'm a physical therapist in Tokyo. It's my great pleasure to share with you the research my colleagues and I have performed at the Tokyo Metropolitan University. The title of our study is Differences in Diaphragmatic and Chest Wall Excursion during Quiet Breathing According to Body Position. Dynamic Analysis by MRI. Today, respiratory physical therapy in acute care settings. Positioning is widely practiced to prevent respiratory complications and plays an essential role in pulmonary rehabilitation. For this purpose, a profound understanding of which position is the best suited in increasing ventilation seems to be an important clinical perspective. Therefore, our research group decided to focus on body position. The diaphragm is the major muscle of respiration, and a linear relationship has been shown between diaphragmatic excursion and pulmonary function. Thus, the assessment of diaphragmatic motion can predict pulmonary and ventilatory status. It is also known that movement of the diaphragm is greatly affected by body position. Ultrasound imaging has been used in many studies to visually evaluate diaphragmatic excursion, but this method has the limitation of being able to evaluate only small movements of limited region of the diaphragm. Recently, the use of dynamic MRI, an imaging technique for evaluating diaphragmatic excursion, has made it possible to observe the entire movement of the diaphragm and the chest wall. Nevertheless, most studies using this method have been performed only in the supine position, and few studies have been performed in the clinically important prone and side-lying positions. Thus, we hypothesized accurate assessment of diaphragm and chest wall excursion in the prone and side-lying positions could provide valuable information for clinical positioning selection. The purpose of this study was to explore the body position in which the diaphragm and chest wall have the greatest amount of excursion, that is, the most suitable position for ventilation, in order to find new insights for the prevention of respiratory complications. For this purpose, we used dynamic MRI to quantitatively evaluate diaphragmatic and chest wall excursion in the supine, prone, and right and left side lying positions to determine the differences between these positions. We dynamically imaged diaphragm and chest wall excursion during quiet breathing in 4 positions in 40 adult male and female subjects using the single-shot fast spin echo method of MRI. The results shows the diaphragmatic excursion was greatest in the prone position, which was significantly different from all other positions. However, contrary to my expectation, the supine position showed only slightly greater excursion than the side-lying positions, and there were no significant differences in the excursion of the upper chest wall in any of the positions. In contrast, the lower chest wall exhibited significantly greater excursion in the prone position than in the other position. The result of this study showed the prone position is the optimal choice of positioning for enhancing lung expansion and increasing ventilation. Side-lying positions may not be suitable for increasing ventilation since there is no significant difference in diaphragmatic excursion compared to the supine position. Therefore, it's suggested the prone position should be the first choice for positioning considerations and may contribute the most to the prevention of respiratory complications. However, this study has limitations. This study was performed on healthy adults and the result may differ from actual clinical settings because of differences in the population of elderly people with respiratory disease and environmental factors surrounding the subject, such as the connecting medical devices. We expect additional verification under conditions more similar to actual clinical practice. In the future, we'll bring the findings of this study closer to generalization to clinical practice. Thank you for your attention.